Introduction to Pharmacokinetics. This video is an introduction to pharmacokinetics, the science that explains how drugs move through your body. Understanding this helps ensure medicines work safely and effectively. Welcome to PharmaconHealth, your gateway to mastering pharmacology with science, simplicity, and clarity. What is pharmacokinetics? Pharmacokinetics is the branch of pharmacology that focuses on the movement and processing of drugs inside the body. It studies for key processes: absorption, how the drug enters the bloodstream; distribution, how it spreads through tissues and organs; metabolism, how the body chemically alters the drug; and excretion, how the drug or its metabolites leave the body. These are collectively known as ADME. Think of pharmacokinetics as tracking a package's journey from the moment it is delivered to your doorstep until it is safely removed. Why and how is pharmacokinetics studied? Studying pharmacokinetics allows us to predict critical clinical factors: when a drug will start to work, how strong its effect will be, and how long it will last in the body. For example, if you take a painkiller, you want to know how soon it relieves your pain, how long the relief lasts, and when you might need another dose. Pharmacokinetics also helps us decide the best way to take a drug. Some medicines work better as tablets, others through injections or patches on the skin. This choice affects how much drug gets absorbed. Designing safe and effective dosage schedules is another crucial application. Too little drug may not work. Too much can cause harmful side effects. To do this, researchers measure the drug concentration in the blood over time, known as plasma drug levels. These measurements help calculate key parameters that guide dosing. For example, absorption, a core pharmacokinetic process, directly influences plasma concentration and is the primary determinant of a drug's bioavailability. Bioavailability refers to how much of the drug actually reaches your bloodstream and changed. Different formulations or manufacturers can have varying bioavailability. Food, drinks, or other drugs you consume can affect absorption and metabolism. Some foods may increase or decrease drug levels, which can alter effectiveness or cause side effects. Pharmacokinetics also accounts for organ health. If someone has liver or kidney problems, these organs may clear drugs slower or faster, impacting dosing. By understanding drug levels in blood, we can predict concentrations in tissues, the actual sites where drugs exert their effects. Many drugs bind to proteins in the blood. Only the unbound fraction is active. Changes in protein levels or drug binding can affect how much active drug reaches tissues. Pharmacokinetics versus pharmacodynamics. Pharmacokinetics describes what the body does to the drug: absorption, distribution, metabolism, and elimination. Pharmacodynamics focuses on what the drug does to the body, the effects it produces at the cellular or receptor level. Both fields are essential for understanding how drugs work safely and effectively. Key pharmacokinetic terms. Let's define some key pharmacokinetic terms. Bioavailability is the portion of a drug dose that reaches systemic circulation and changed. Half-life is the time it takes for the plasma drug concentration to reduce by half or 50%. This tells us how long the drug stays active in the body. Clearance measures how efficiently the body eliminates a drug through metabolism or excretion. Volume of distribution is a theoretical volume representing how the drug disperses throughout body tests. Use in fluids. Factors influencing pharmacokinetics. Patient-specific factors strongly influence pharmacokinetics. For instance, aging can reduce liver and kidney function, slowing drug clearance. Genetic differences affect how enzymes metabolize drugs, leading to variations in drug response between individuals. The chemical nature of the drug, its formulation, and how it is administered also affect absorption and distribution. Environmental factors like diet, smoking habits, and other medications impact drug metabolism and effectiveness. Pharmacokinetic models and tools. Pharmacokinetic models help visualize drug behavior. The simplest one-compartment model assumes instant drug distribution throughout the body. A multi-compartment model accounts for drugs entering tissues at different rates. Reflecting a more realistic distribution, drug levels in plasma are measured in clinical Settings to monitor therapy. Sophisticated software tools assist clinicians in optimizing doses tailored to each patient. Thanks for joining us for this introduction to pharmacokinetics. If you found this helpful, please subscribe and share Pharmacology series and PharmaconHealth with others eager to learn. In our next video, we'll explore drug absorption, the very first step in how medicines enter your bloodstream. See you soon at PharmaconHealth.